My name is Nasar. I'm the owner-operator of Celebree School of Bristow. And this is Shar. And she's going to introduce herself.
I am Shar Fuller. I am a nurse in Northern Virginia. I've been a nurse for 21 years. My specialty is women's and children, specialized in labor and delivery.
All right. So what are we going to discuss today, Shar?
A lot of questions that Mr. Nasar gave me,
Okay.
basically about, being a new mom.
Yeah. So we get a lot of people, new parents, basically. And I wanted to start a series that helps them understand what happens during that postpartum time, especially
Yes.
right after the early postpartum days. What are some of the questions they might have, and we want to try to help answer those. Does that work?
Yep.
All right. Let's start with the first question. The realities of postpartum recovery. What happens?
A lot. I think people come into the hospital and they think, oh, I'm just going to pop a baby. But it's not true. People even think, oh, when my baby comes out, contractions stop. I actually tell a lot of my patients, like, nope, it's just the beginning. Even you come home for the first 2 weeks, you still have it. So what happened again? I guess when you go in, I always tell this to my patient, this is time for you to have a birthday party. First to come in, yeah. Like for new moms and new dads, I told them, because they're also nervous. So I have to tell them, like, why are you nervous because you're going to the hospital? They said, oh, because either I'm going to get caught for people that have a C-section, or people like, because I'll be stuck here for days. And I always tell them, like, it's okay. It's just a preparation for your birthday party. And at the same time, you will get a pre-babysitter in the hospital for a couple of days.
That's true.
But what happened is, like, of course, it starts with induction at labor if your cervix is not ready. I always tell them, like, if the doctor tell you you're being induced, then of course, don't count it as your day. Count it when they say, okay, we're ready for the Pitocin. For a lot of new moms, I would tell them, like, expect you're in for the longest haul, because it's not gonna be just one day and that's it. As soon as the baby pops, of course, you stay them for a couple of hours, stay with your labor nurse. You might stay a little longer just in case you have elevated pressures, you have like bleeding. And then if you get lucky and everything is okay, you go to postpartum for like after 2 hours. If it's normal vaginal delivery, you stay there for 2 hours. I mean, 2 days, sorry. And then for a C-section, you might stay for 3 to 4 days. And then after that, you're a whole family. You're going home with little pumpkin.
So when we were having our daughter, it was during the COVID time.
Oh.
So my wife loved it. Nobody could come to the hospital to visit us. It was just me, my wife, and our newborn daughter.
Yeah.
We stayed there for 2 days, and because I worked so much, she thought it was a mini vacation.
Yeah.
And when our son was about to be born, she was really looking forward to going to the hospital to have the baby, because she was like, for the next 48 hours, you can't go out. You won't be taking calls because you would be with me.
Yeah.
And she literally, everything was catered for.
Yeah.
She was getting food in the bed.
How did it happen? Like, labor patient don't eat.
Well, she ate.
She's lucky.
Yeah. And then, well, after the delivery, basically, every need of hers was taken care of.
Yeah.
I was right there. Our daughter was being taken care of by my mom. So she really loved it.
Yeah.
And that's, I think, the best part of having a baby, that she really enjoyed being in the hospital. Normally,
Yes.
a lot of moms are scared of that. And my wife was like, that's the best time I could ever have.
Plus, I always tell them, like, people are scared because they're having a baby. I do not really know why, but I told them, this is the best place that you should not be scared of. Why? Because you have a nurse, you have a doctor, you have anybody that could help you.
You have a nurse that comes in every 2 hours and destroys your sleep.
Next time you have a baby, you should go to our hospital. You don't go every 2 hours.
You go what? Every hour?
Yes. Sometimes every 15 minutes. Yeah.
Oh,
so they call it hourly rounding.
Yeah. Oh boy.
Yes.
That is one thing that I did not enjoy.
Well, we want to make sure everybody's safe.
That's true. So what are some of the biggest physical challenges moms faced within the first 2 weeks?
So it's a lot. Like, postpartum can be overwhelming. A lot of moms could take them by surprise, but what's going to happen? First, I think it's the first nightmare for moms is the contraction or the afterpains. Like what I said in the beginning, they think after the baby comes out, no more contractions. So as your uterus go back to its pre-pregnancy size, the more you contract. Unfortunately, for moms that are lactating or breastfeeding, the more contractions they would produce. Why? Because your body produces a pitocin or a hormone called pitocin, which contracts your uterus to avoid you from bleeding. And at the same time, it produces during breastfeeding. Next is pain. Lots of pains. Pains from tears from laceration, which could take about 6 weeks to heal. It depends, of course, on everybody's recovery. Next is breast engorgement or nipple sore. And what's hard about it is when you really want to breastfeed and your breast is engorged, it won't happen. Like mom will be more emotionally stressed and physically stressed. Next is night sweats. I always tease my patient. Like I always give them like a little fan, and they will look at me like, "Why are you giving me a fan?" I said, "Trust me, you would need this 24 hours. You would need this. Why?" As soon as we delivered, it's I feel like it's magic all the time. And in like an hour, your body just go back to like pre-pregnancy rate, body right away inside, not physically.
Yeah.
Your pregnancy hormone decreases. So if your pregnancy hormones decreases, your body produces more fluids, and that's how they secrete it. And then, of course, I guess the first-time moms did not expect that they have to change their gown or their clothes 3 times a night or the
Yeah.
entire bed cover because they would wake up drenched with
Sweats.
sweat.
Yep.
Yes. Next is difficulty in bowel movement. So people that have like laceration, um, even just like actually the worst is episiotomy. They tend not to I would say they hold their bowel movement just because the fear of, oh my god, if I strain, my
It's gonna.
stitches will
Yeah.
open. I like this one because I call it like exhaustion beyond imagination. Why? Because everybody sleep pattern, you're sleep deprived, you're a first time mom, or even the not so new moms, they're like all sleep deprived. Why? They have to
As I
take
said,
care.
because of the nurses coming
No,
in
no, no,
every
no, not
hour.
just nurses. It's because you were in labor,
Yeah.
but the nurses give them some time. Okay, sometimes they can borrow the baby and like,
Yeah.
okay, mommy, even it's not a policy
Yeah.
of the hospital. We don't have nursery.
Yeah.
I'll cuddle with your baby.
Yeah.
But like what I said, it's just because they were in labor, they're recovering from birth, and then of course responding to that 24-hour for the baby care. That's a lot. And I always teach my patient because they always watch the babies, even like your baby's sleeping, mommy, it's okay. But still no. And they say, mommy, your eyeball's gonna really drop. You gotta stop. It's okay. No one's gonna take your baby. I think the next is emotional and physical disconnect. A lot of people think that having baby is just like a movie. They tend to forget recovery is a real thing. It's not like movie like once you come out, oh, I'm perfect again. Next is for people that had C-section, they kind of tend to overlook it as like a minor surgery. They just think like it's a little scar, like this scar, but they did not know for that incision to heal, the muscles needs to heal too, and that takes time.
Yeah. Cool. How long does the recovery usually take, though? So for a natural delivery, on average, how long should it
6
take?
weeks.
Up to 6 weeks.
Yes.
Okay.
For the C-section, it might
Yeah.
be like 8 to 12, 6 to
Okay.
12. It depends. It
Okay.
depends really on how they heal,
Okay.
especially if you have some complications.
Yeah. What are usually the most common complications that you can have?
So recently, since you mentioned earlier, COVID,
Yeah.
I've not just me. We've noticed a lot of patients now have hypertension
Okay.
or preeclampsia.
Yeah.
I actually do not know because why before people that have elevated pressures are like people that are advanced maternal age. So I would say 35 years old and above or 40, or people that really were diagnosed of hypertension prior being pregnant. But now even a 16-year-old could be yes,
Interesting.
yes, and I wish I had more time to do
Yeah.
research about it, but yes. Number one is hypertension. Second is hemorrhage. I actually did a study 2 weeks ago about the recent mortality. One of the first mortality is like hemorrhage.
Interesting.
That's the research that was like 2020, 2022. Yes.
Okay.
So
Cool.
16% about pregnant end up having hemorrhaging.
Should moms feel guilty after the birth? Because I've noticed that a lot of moms feel guilty if they can't breastfeed or if they can't give time to the child or any of those stuff. How does that work?
Some moms, yeah, they feel guilty, but I feel like they just feel guilty because they they went in without knowledge. Number one, they feel guilty because they think like on the first day, the milk will produce. It's not going to produce. I mean, you really have to give at least 3 days to yourself. they went in without like prenatal kind of like education. I think they should not feel guilty.
Okay.
And colostrum is only like few drops, literally like 3 drops, 3 to 5 drops.
Let's talk about that first. What is colostrum?
Colostrum is the first milk
Okay.
that before it becomes milk, that's what's going to come out first. And that's the most nutritious for the baby. And mamas will try to milk their breast, try to do hind expression. They're not really going to get anything. Most of the time, the complaint that we get, not complaint, like kind of like the concern that we get from the patient is like, I'm not producing anything. But then we could see the baby swallowing because, yes, you might not see, because it's only 3 to 5 drops each latch.
Yeah.
So you're not really going to see it, but you would see your baby is content. The other thing, you would see the baby's peeing. So you know that they got something.
Do you think those 3 to 5 drops are enough for a newborn baby?
Yes. Why? Because the baby size of the belly is the size of my little finger.
Oh, okay.
Yes.
Fingernail, basically.
Yes,
That's all.
that's yes.
Interesting.
And at 3 days, it gets bigger, the size of a marble. So at 3 days, you can give 20 cc, but at a newborn, 24 hours.
A couple of drops is
A
enough.
couple
for
of
them,
drops is enough,
basically.
yes. Because if you give them 20 cc, they're just going to be like throwing up.
Yeah.
Plus, no breastfeeding is only 15 cc.
Okay.
So
how many is that in ounces? Because most things actually come in ounces.
I am not sure, but
That's
I know
okay.
5. I know 10 cc. I'm not good at math. That's why I become a nurse, by the way.
Tell me about some of the small things that make a huge difference in recovery that most people would overlook or think that that's not going to work. I mean, any of the small things that newborn moms should be doing that would help their recovery for the mom.
For the mom, I think most of them tend not to say they need help when they needed help. They think they're super moms that just would power through. Even their husband is sitting beside them, or there's like tons of uncles and aunts and grandmas on the background. They would just like, even they're hungry, they would stop whatever they're doing just to feed the baby. I think they need to rest. They do cluster feedings. They do shifting with their family members.
Sorry, what is cluster feeding?
So when the cluster feedings happen, like babies nonstop this, right? So if babies nonstop eating, they need to like ask for help. Like, so, okay, first 3 hours, I'll do it. The next 3 hours, I think my husband should help me with this one. So I could sleep. And then for the next 3 hours, for sure, that baby's going to be in the breast again.
So if the baby is breastfeeding, how does the husband or the uncles
could
or
help?
aunts? Yeah.
So in the hospital, we do have donor milk.
Okay.
If that would help. Or for first-time moms, we always initiate breast pump. So if you do pump, you could pump right away. Anything that you get today, this hour, for sure. Because you pump after you feed your baby.
Okay.
So after you feed your baby, hopefully you can collect something, right?
Okay.
Even if it's just like 10 cc, that's okay. So the next feeding, we can save it. We can put it in our fridge. So the next time the baby would eat, the daddy can give that feeding to the baby. So at least mama could at least have 3 hours or 4 hours to sleep at nighttime, especially.
Got it. There's a lot of emphasis on body to body touch with the baby, especially
Skin to skin.
Skin to skin. Yeah. So why and how does that work?
So skin to skin, we try to do it as soon as the baby delivered. Right away, we put them in mama's chest. Why? Skin to skin helps baby kind of like adjust to the environment quickly. And then for babies that have like respiratory problems, they adjust quickly. Why? I think mama's comfort does it. Like
I know dad's comfort. Why don't you give it to the dad?
So I'm going to give an example. Temperature. The mama's temperature if you put baby in mommy can warm the baby and mommy can cool down the baby.
Interesting.
If I put that to daddy, daddy can warm the baby, but daddy will never cool down the baby.
Interesting.
I know. I learned that too in a hard way. I thought, wow. I think it's magic. That's what I told my patients. It's magic. There are some things that dad can do that moms can do.
Like what?
Cooling the baby. Or become a super mom.
All right. So it's a huge thing that there's a lot of moms that go through postpartum depression Let's talk about that. What
Okay.
is it? Why is it? And what are the symptoms?
Postpartum depression can happen at least the first 2 weeks. It could be intense in the first 2 weeks. The first one, it's okay to be to feel anxiety, to feel like kind of like anxious in the first 2 weeks. But if you think it's more intense, it's time for you to reach out, especially if you have history. So what we call first is the baby blues. The baby blues is like, oh my God, I feel guilty. I didn't feed my baby today. It's my husband to feed my baby. Or it's like you constantly check in on your baby. You're feeling like, oh my God, something's gonna happen with my baby. Those baby blues. But then of course, it turns out to real depression if it's beyond 2 weeks. And if
Okay.
you start experiencing that, we really suggest you to kind of like call the doctor. And I always tell this to my patient. That's why it's important when you go to your pediatrician and give you a hand paper. Like I personally said that. Like, why are they asking me again if I feel anxious? If I feel happy, how many times I smile a week? A lot of people, I think, take it for granted. Like, oh, a piece of paper again. Let me grade myself again. Check, check, check. Because I did that.
Yeah.
But there's reasoning with that because postpartum depression could really occur for at least 1 year, the first year.
Interesting.
Mhm.
So it can start pretty delayed.
It can,
Let's say, okay.
yes, it can. It could happen during pregnancy also.
Okay.
I forgot that. Yes. It could happen during pregnancy. It could happen right after delivery, which is called postpartum blues, and then it could happen months later after
Okay.
pregnancy, in the span of like a year.
So if a mom is getting that, what are some of the symptoms of that?
So I hate to say to the hard part first. I feel like thinking about hurting themselves, thinking about
Okay.
hurting their babies, thinking about like really like they don't bond with the baby, nothing at all. They feel helpless. But really, the big thing is thoughts of like,
Self-harm.
yes, self harm.
Got it.
Hmm.
Got
And
it.
believe it or not, we have a lot.
Unfortunately.
Yes.
So if you are in that situation, what should you be doing?
So when you leave the hospital, I don't know if all hospital, but in our hospital, we always have like a discharge paper for our patients. In that, we have discharge instructions and says like call 911 or call the said hotline. There are also like groups, we support groups that we recommend them. These are the list that you should go. Of course, if in us, we also have behavioral health consult. So if
Okay.
we kind of like we call it a postpartum depression scale. So
Okay.
within 24 hours of birth, we ask moms same questions that they would answer for the next 12 months. But if they score high already, we try to give a case manager consult, a social worker consult, and then of course, if we really think it's kind of like concerning, we bring the behavioral consult. So
Okay.
psychiatrists could come. And if we need to send them to a different facility, we send them.
So the idea is ask for help
Ask for
for
help.
at any
Hmm.
stage, and they should definitely get that.
Hmm.
Got it.
And support person would always be.
Anything else that you want to dig into around that? No.
Always just ask for help.
Always ask for help.
Yes. I
Always
mean,
ask.
a lot of people just keep like to themselves. What I would suggest for the support person, either a friend, husband, sister, even neighbor, always talk to them because if you won't say it, you keep it to yourself. It one day it could just like burst and like here you go. You're gonna lose your baby because you're gonna go have to somewhere else to treat yourself too, and you don't
Yeah.
want to miss those times.
So a lot of moms that either choose or just cannot
Mm-hmm.
breastfeed, they feel bad for one reason or another. Let's discuss that.
So they feel bad because they cannot produce milk. But I always tell them there's different ways. We have human donor milk in the hospital. We also have formula. A lot of people doesn't like formula because they're synthetic or there's something in there that they do not want. But I if I'm your baby nurse that I'm about to catch a baby and I knew you have blood pressure, I mean you have diabetes. So I'm 100% sure your baby's blood sugar will be low. So if I cannot get anything from your breast, I would really recommend you to give a formula. Why do I do that? It's because I'm trying to save you and your baby being separated. Because if your baby has 3 low blood sugar, for sure, I would have to call the neonatologist, and chances are that would never go up if I won't give anything from your breast. Formula will always like make that sugar a little higher, and then sometimes only one formula, your baby sugar is okay. Yeah. But before I jump to that, I always call lactation nurses.
Okay.
Lactation nurses help us do hand expression because, like what I said earlier, you only need 3 drops. 3 drops would save your baby and would increase the sugar.
Got it. Should they feel bad about it?
They should not feel about it because, like what I said in the beginning too, milk production doesn't start till 3 days. So the
Okay.
first 2 days is only just like nothing. We have to wake the glands up, and waking that up, we have breast pump to use. So as soon as we set you up and you're still not doing something, then maybe you could feel sad about it, but you should not feel bad about it.
A lot of times when parents are leaving the hospital with the baby first time, they feel as if they don't know what to do with the child.
Yeah,
They're
like,
totally unprepared.
yeah, it's like what I told you. They hand me the baby and like, okay, bye, Shar. When would you know?
So what are your recommendations about that? What should they be worried about it? What happens?
So I always tell this to my new patients now, even the patients that come in and they're not ready to pop the baby. I always tell them like hospitals, not just hospitals, a lot of like even the OB clinics, they always offer baby classes.
Okay.
So I would recommend them to, and they're free. Some of them are paid, but there are free classes that they could go. At least they can know like what's parenting 101, what to expect when the baby comes home, what's like just the basic itself. I would recommend that. If they do not know when they get discharged, they get this discharge instructions. They typically know all the normal. The doctors and the nurses will give them like, okay, here you go. This is your paperwork. It's ready to go home. This is what you expect. So I always tell them like, ask questions. If you think they tell you ABC, and if you think you need more than that, don't go home until you get the answer. Or you always call your pediatricians and your OB because there's always a hotline number.
So a lot of times, I know when we were having our first baby, we didn't have a pediatrician yet in mind. My wife had her gynecologist. She had recommended a bunch of pediatricians, but we hadn't chosen one. What do you recommend for that?
So number one, you guys will not be discharged in the hospital if you guys don't
Okay.
have pediatrician.
Got it.
Like, I would personally tell you, like, okay, mommy, if you're not going to pick up pediatrician, unfortunately, I cannot send you home. Why? Because we do have screenings that we have to send to your pediatricians.
Okay.
And the State Department actually is the one who required us to have like pediatricians before you guys go
Interesting.
home. Mhm.
Okay. So it's kind of by law
It is
that
by
you
law.
have to
Mhm.
have a
Yes.
pediatrician before you go. Okay. So I would recommend find a pediatrician basically before.
Yes, I always
go to the
recommend
hospital.
like whatever. If you are not a new mom, if you
Yeah.
have like bigger kids,
Yeah.
pick the same pediatrician.
Okay.
So for comfort for you
Yeah.
all, and then pick whatever close to the area.
Yeah.
I mean, here in Manassas, it's like there's always a well-known doctor in here. I'm not gonna say it.
Do you think hospitals do enough to support new parents?
I try not to answer that question for you because I feel like I work in a hospital. But I have to answer it. Yes, I think yes and no.
Okay.
Yes, because like what I said, we offer classes. In our hospital where I work, we offer classes and it's free. And it's not just one class, it's like different classes. We have breastfeeding class, we have like prenatal classes. All you gotta do is to come there. Although I feel like it's not still enough because I feel like a lot of people needs more.
Okay.
Yes.
When we were having both our babies, they recommended parenting classes for us.
Yes. Mhm.
So, and it was part of our hospital. It was paid for, everything.
Mhm.
Some of them were free as well. You just gotta find those. Those
Yes.
resources are there. You just gotta find those.
Yeah. Plus, the other thing that I do not like is like they offer it online.
Yeah.
So it would be nicer if it's like
In person.
in person.
Yeah.
Like at least for baby classes, at
Yeah.
least you could learn how to swaddle your
Yeah.
baby. Because I heard it from all patients like, Shar, I don't even know how to swaddle a baby.
Yeah.
One patient told me they tried to swaddle their dog. I said, oh my God, how are you going to swaddle the dog? Just to practice because they think the dog can move around
Yeah.
and just like baby. I said, oh my God,
That's hilarious. by
that's
the
a little
way.
hard. It's a little tough for you all to learn.
What's something every new parent should remind themselves on the hardest nights? Because I know when we had both our babies, 3 months, there was barely any sleep.
Oh
And-
my God, I
yeah.
have 6 months in 1 year, maybe. You guys lucky.
Well, my kids are 5 and 2 now, and they still don't sleep through the night. So they still crawl out of their bed. come into our room and then sneak in, and then
Mhm.
they're out.
Yes.
But for those 6 months, first 6 months, I've noticed 3 to 6 months, it is really hard because moms, especially dads as well,
Mhm.
are exhausted because you're constantly just taking care
Yes.
of the baby every 2 to 3 hours, 4 hours. As again, they grow up, the age helps with the sleep pattern,
Yeah.
but still, the first 3 to 6 months, it's pretty hard. What do you recommend they should tell themselves around that time?
So I always believe in routine
Okay.
because it's a newborn, right? You
Yeah.
can always train them.
Yeah.
With Mia, we trained Mia really,
Okay.
really well. I believe.
How do you train a
A newborn.
month-old? Yeah.
Yeah. Well, the first it's hard. The
Yeah.
first day, the first month is hard because you're trying to figure out about yourself too, because
Yeah.
you're recovering too.
Yeah.
But as you recovered, like what I said, 6 weeks you should be up and running. Hopefully, it depends on you too. If you really want to be well, then you have to give yourself a timeline. 6 weeks, I should be okay. So with her, we starts with the feeding. Said, okay, we're gonna feed you by 8, by 12, and 4, and this. And the first week is struggle. But if you keep constantly doing that, you'll be able to train her
Yeah, but don't just say you should feed the baby as they're hungry.
as they need.
Yeah.
Yeah. But you're going to bed, right? You wanted to rest too.
Yeah.
Self care as well.
Yeah.
So what I would do is what I did that time is like I know Mia needs to feed at dinner time and I have to eat at dinner time too. So I would feed her first, like at 5, and then at 6 o'clock it's gonna be my dinner time. So that means at 5, 6, 7, 8, then 8 o'clock Mia would eat again. At that time I had to be get ready at bed. And then 9, 10, 11. Sometimes I would do at 12. I'll wake up mid 12, or my husband would wake up at 12 to feed Mia. And then at least I would have another 4 hours of sleep. So it's not just like timing the feeding, it's also you and your husband and kind of like taking time, taking turns and
Yeah.
like
So I know a lot of parents that prefer free feeding, that whenever the child gets hungry, you just feed them. What do you recommend? What do you think is better? Is free feeding better for the child, or is putting them on a regiment better, or a schedule better?
again, I'm gonna say it depends on what you believe. But to me, if you want it to be like on a routine method, which is more kind of like good for moms, because you always need to have schedule, I'll go to the regimen, right? But if you wanted to wait until your baby is ready, then and that works for your family, go for it. But sometimes that could be actually difficult too because you might oversleep
Okay.
and babies could oversleep too.
Yeah.
I remember a patient told me like she hasn't fed her baby for 8 hours. And I'm like, oh my God, like I don't know how to react. Sometimes I don't have filter in my
Yeah.
face and I was like, oh my God.
So was the baby not crying for those 8 hours? What?
Well, of course, because the baby sugar is low. So the baby's gonna be like,
Okay.
right,
Yeah.
sleeping.
Yeah.
Yes. So
Got it.
that's why I don't want to recommend that as well.
The world puts a lot of pressure on new parents,
Yes.
telling them that they're not doing enough for their children.
Mhm.
What are your thoughts?
I always tell them is they're not always that perfect. Like whatever is good for that neighbor will not be good for you. If you believe to yourself that you're doing what is good for your child, stick to that. Because one day you could tell yourself like, oh my God, I raised that child.
So it could be it's just your personal circumstances,
Mhm.
and you just got to put as much
Yes,
effort as much you can to make sure that they're well.
yes. Plus, don't listen to pressure. Peer pressure is bad,
Got it.
especially from
it.
family.
It is, well, it depends a lot of things. So in our school, for example, a lot of parents come in and they complain that their child doesn't eat a lot.
Uh huh.
So we tell them once they are in our classroom, peer pressure will make them eat, which actually works
Yeah, if they eat with their
with their peers. Yeah. So the friends that they have in their classroom, they sit down with them, they watch them eat,
and then they eat
and
too.
they eat too. It
Hmm.
just depends. So it depends what kind of peer pressure we're talking about.
Yeah,
It
but
can,
sadly, the peer pressure for moms are
Mhm.
like peer pressure from the family.
Yeah.
Typically, it's the in-laws,
Yeah.
it's the mom,
Yeah.
the cousin, it's the sister, and they compare how they raise their child.
Yeah.
I always tell them, you just pick their brains, pick whatever in how they raise their kid, and pick which one would work for your
Yeah.
family as well.
choose.
Choose
can,
wisely though.
yes.
Yes.
You can listen to all the advices that everyone is
Yes.
giving, but you got to choose what you want to implement
Mhm.
and what might work best for your own family.
Yep.
Awesome. Anything else that the new parents should definitely know about?
That they're not alone. It should not just be mommy all the time. It should be raising a kid should supposed to be a group effort. Their husband should also support them because and always think like the wife it's just not physical. It's physical, emotional, and mental. Because husband always think, oh my God, you're already home. You can cook a meal, right? It's not like that all the time. And then for moms, when I said they're not alone, if their husband is not available, I just actually found out you can get a support group through your insurance. So if you think you going home and you think you guys do not have enough support, get somebody. It's called doula. They
Yep.
even offer like 2 weeks of your insurance will pay for that because that 2 weeks of recovery would help them. And then for dads, watch their wife because they could be quiet, but deep inside they're feeling something. And for moms, if they feel that thoughts, you gotta speak it out because if you won't speak it, it's just gonna like keep going and going, and before you know it, it's already like it's been yes too late.
A lot of parents think when kids come to a preschool or a daycare, they get sick a lot.
Yeah.
What are your thoughts about that?
Well, I answer this. I okay. Let me answer it safely.
Safely.
Yes, safely. Yes. Why? Because they're before they're I'm gonna use my example as my kid. My kid is a homebody for like 4 years. Never go to daycare, always home. And of course, if she goes to school, she's gonna get sick. And that's okay. Because why? If she gets sick, that means her body is building immune. So it's healthy too. Yes, it's not healthy because other moms think like, oh my God, I gotta get her something again. She gotta go to pediatricians again. But no, I always think it's good. It's good for them to get little germs, a little bit of bacteria, so your body kind of like develops it, and they get healthier.
So this is what my thinking about that. They are going to get that sickness even if they go to the public sector, public
Yes,
schools.
yes.
You can either get that immunity built up before they get there, or you can get it done when they get there.
Hmm.
And again, my personal opinion is the quicker you get them exposed to things, the better the immunity is going to be.
Yeah. Plus, it's better if you get it at school because they learn and they meet friends.
Yeah, that social and emotional
Hmm. Hmm.
aspect of being in a preschool is a big thing.
You can
It's a
always
huge
treat it
thing.
with Tylenol and humidifier, so it's okay.
That's
I
funny.
always tell them no.
You know what they're saying about Tylenol nowadays, right?
I do.
Okay.
That's the only thing I give to my daughter and me.
There's a lot of pressure that moms put on themselves about snapping back or being picture perfect right after uh, delivering a newborn baby.
I
What do you
had that.
recommend them?
I had that dream too. I even asked my husband when I'm gonna be like Shar again. Well, that's actually like I feel like I answer that every day, and I lost count. Like, and I always tell this to my patient: it's okay not to look perfect. It's okay to look like you had a mom. You become a mom because that's beautiful. Because not everybody can do that. Snapping back to your own self. First, recovery. You have to focus on recovery first because it will take about 6 weeks. And then, of course, you cannot go to the gym right away. You can do little exercise for the first 2 weeks, but you will not lose your baby weight and all the fluids that the hospital or the nurses push on your body for the first 2 weeks. It takes about 6 weeks, and then, of course, intense exercise. I would tell actually everybody give yourself at least a year.
Okay, so you think it takes about a year
It takes about a
to start
year
back?
because look, you gotta if you're a new mom, you gotta learn how to take care of your baby first. You're gonna forget to brush your hair. You're not gonna focus on that one. You're gonna think about like why my baby crying right now? When my baby gonna eat again? Oh, I have to do the groceries. Oh, I have to make dinner for us too. But then how like I really think new moms need to kind of like it's okay. It's okay. You're gonna lose that. Running on that baby one
Are
day.
you though? Are you going to lose that? Because I do know moms that put on,
A lot after.
yeah,
So
so they actually put on more after than before.
yes. Sorry if I said that you're gonna lose it. Some moms would lose it. It depends again, hereditary.
Yeah.
If your family are all big, then of course you're not gonna be like skinny, like Barbie, right?
You
If
could
your
try.
Barbies, you could try. Yeah, you
Yeah.
could really try.
Yeah.
But a lot of discipline.
Yeah.
Yes, really, you gotta discipline yourself. A lot of you really need to be focused. A lot of sacrifices too. If you really want to stay.
Yeah. Got it. All right. Char, really appreciate it. Thank you for your time.
No
And
problem.